Hello, my name is Sarah. I work in the education department and I manage students that come here for clinical rotation. So if any of you are in school and are interested in coming here in the future, maybe for our fall semester, I would love to give you some information about that. I also coordinate our patient care tech program, which is a course that teaches people how to become a patient care tech that do not have a CNA license. So I also help with orientation, and today I'm going to be speaking with you about professional practice. So one thing I love about St. Vincent's is the nurses have a lot of opportunities to get involved, and they also are able to share their voice. If they have an opinion, if they have an idea, they can share that in the council that they choose to be a part of, and they can also share that during their unit huddles. And so I'll go over some of the ways that you can be involved if you're interested in growing as a professional. So these are some of the objectives that I'm going to discuss. I'll show you our professional practice model, and there is an image of that professional practice model on your book that you've been given for orientation if you want to check your email. I'll also discuss relationship-based care, opportunities for you to grow as a professional. There's ways that St. Vincent's will support you if you're interested in growing in your education, perhaps, or being certified. There are opportunities for that. I'll also discuss shared governance and primary ways that we communicate here at the hospital. Okay, so our professional practice model. We use the American Nurses Association as our basis for guidelines for how we develop our professional practice model. And I'll read a little bit, but it's a framework for nurses. Why do we do what we do? What's our background? What's our purpose? What is our mission? Why do we care for patients the way that we do? And some of our mission was specific to our facility specifically, which is one thing I like working at St. Vincent. So we'll discuss our mission, our relationships. I feel like the nurse is always the go-between for the patient, for the doctor, for the therapist. The nurse is the advocate, and they have to speak with so many different professionals. So we'll discuss some of those relationships. We'll also talk about our care model and our shared governance. And one other thing that's really great here is we have multiple awards. And so if you do something outstanding, or maybe you have a coworker and you hear a really great story about them going above and beyond, you can nominate them for one of our awards because it's really great to receive recognition for doing something above and beyond. Okay, so the mission of St. Vincent, to nurture the healing ministry of the church, supported by education and research. Fidelity to the gospel urges us to emphasize human dignity and social justice as we create healthier communities. So St. Vincent is a faith-based organization. We do have a chapel here on campus. We do have morning and evening prayers. And so we do stand by our history that the nuns built our foundation upon, which is really great. Also, we have 4 core values: reverence, integrity, compassion, and excellence. And I think these core values are something that every nurse probably has anyway, hopefully. Maybe that's what made you want to become a nurse, because you have that compassion for others, or you have that goal, I want to be excellent and provide excellent care for my patients. And so those are our core values here at St. Vincent. Okay, this is the model that I was referring to when I referred to your orientation book. And so I know you probably received that electronically in your email, but this is the picture that I'm referring to. And it's a really nice picture, and it's supposed to symbol stained glass like you would see at a cathedral or a chapel or some type of religious facility. And the stained glass represents different people and different elements: professional nursing, teamwork, leadership, the environment. Is the environment conducive to healing? Is it quiet? Is it calm? Our outcomes, quality, like Kelly was talking about, the survey the patients receive. Did they receive quality care? At the center of our professional practice model is the cross. Like I mentioned, this is a faith-based facility, and so we do have Christ as the center of our mission, which is really something that's great to refer to if you, are unsure of why you're doing something. Think back, it's to serve others, to help others that are maybe more vulnerable than you or less fortunate than we are. Down at the bottom of the model, it lists the 4 core values again: reverence, integrity, compassion, and excellence. And then beneath the core values, it lists relationship-based care. So here we are believers in relationship-based care, which is a great model. And that doesn't refer to just caring for the patient. It means caring for yourself as well, caring for your coworkers, and also caring for the patient's family. As you've probably seen in previous jobs, sometimes the patient's family member, consumes a lot more of your time even than the patient, trying to meet their needs, trying to answer their questions, and provide education for them. And so the family is included in a part of this relationship-based care. And then our statement, the love of Christ impels us. And so that's the reason why we do what we do, which is providing excellent care for patients. So I'll kind of delve into a little bit more detail with this information that I just discussed for you and talk a little bit more about relationship-based care. So of course, first and foremost, building a relationship with your patients and families. You're not just caring for the patient, but you really get to know them, learn about them. Sometimes they'll want to learn about you as well, ask about your family, your pets, what your hobbies are. I think sometimes being in the hospital isn't the most interesting thing, right? They're laying in a bed, they're bored, they're ready to be home and to be discharged. And so having conversations with them really builds their trust. It also helps manage their time so that they're not as lonely or maybe frightened for being in the hospital. Relationship with themselves. I think especially now with this crisis that's going on, self-care is very important. And I know that's easier said than done, right? And I think everyone has different aspects of self-care that are more effective for them. Maybe what's effective for me may not be the best choice for you, but try to implement healthy self-care aspects. Getting enough sleep every night, drinking water, and taking breaks is very important. I know sometimes on your shift, hand sanitizer, yes, washing your hands, very important. Take your breaks, take your lunch breaks, take your breaks, because if you're running on empty, you're gonna eventually be burned out. So take time to refuel yourself. And then a relationship with coworkers. I think everyone has had experiences where the team that you're working with really makes your shift go smoothly and quicker, and it just, really makes you have a great day. And then if you maybe have a shift with coworkers that you don't mesh with as well, it can make your day more stressful, or you feel like maybe you're carrying some more of the load than others. So having a good team environment is so important. So I know you're all anxious to begin working on your units and meet your team, and I know that you'll bring a great aspect to the team. Okay, so let's talk more about the patient and the family. Be intentional, be authentic. If you're asking a patient a question to try to build a relationship with them, look them in the eye, smile. Don't be on your cell phone texting. That doesn't really portray a good image. Show that you really do care about them. And also, I think dignity is something that sometimes goes to the bottom of the priority list because we're trying to take care of so many other tasks. So shutting the door, pulling the curtain, making sure the patient's gown is tied. Those are things that only take a moment, but for patients, those are really some of the most important things, having their privacy protected. Okay, goal sharing. Sharing the plan of care. A lot of the patients, if you ask them, why are you here? Are you in the hospital? Sometimes they don't know. They don't know what their diagnosis is. They don't know when they're being discharged. And so remember, you're the one that's going between for the physician, therapists, social workers. And so communicate what that plan of care is. If they don't know their diagnosis, absolutely inform them. They deserve that education. Also, I think it's great to give or to receive their input, because patients and family members know their loved ones better than we know them, right? They've been around them for years. They know if they are really sensitive to certain medications. They know if this is typical behavior for the patient or if this is abnormal behavior. And so maybe you're taking care of a patient and upon assessment, everything seems fine. But the family member is insistent that something's wrong, this is atypical behavior, they're really concerned. Listen to that family member, because that family member may be picking up on early cues for your patient. And down at the bottom, that's a great quote by Maya Angelou. Actually, I have it in my office. But sometimes people don't remember exactly what you did. They don't remember you giving them the medications, taking them to the bathroom, doing their assessments. But they remember how you made them feel. So they remember feeling safe or secure or comfortable. They remember their pain is managed. So here at St. Vincent's, we do primary care nursing, typically where the nurse is assigned to her patients or to his patients. And then you have other partners of the care team that work together for the care of the patient. So this model is a really great example of that. The nurse is at the top of the model, and then at the bottom is the family. You know, the family is that foundation. They're the ones giving their input. You know, no, I don't think it's safe for my loved one to go back home. You know, I think they need assisted living, or no, I can provide for care for my patient at home. The care team and the care partners. So all those different healthcare partners that I think, you know, sometimes there's so many: wound care, respiratory, all those other partners we need to work well with. And I love that the center is the patient, because the patient is the focus. It's why we're here. And everyone's goal is for the patient to get well. Okay, so I'll discuss care of self. And this is a nice little image of this lady doing yoga. Maybe some of you are into yoga, or maybe not. But something that you know that makes you feel better, that makes you feel relaxed. You know, maybe it's reading a book, having a glass of wine, maybe it's prayer or exercise. But whatever is good for your mental health and your emotional health. Having therapeutic conversation. You know, sometimes it's helpful to discuss a stressful shift, you know, with another coworker, you know, who can understand what you're going through and maybe can provide you some receptive feedback for that. There are many opportunities for professional development, and I'll go into that later. But growing as a nurse, you know, being a nurse is not a stagnant career choice. There are always ways that you can grow and educate yourself and move forward. Or maybe you feel unhappy. You know, there's other areas you can work in, move around.
Is there a chaplain here that would speak with staff or maybe debrief with staff after really stressful events like codes? Or do you have any kind of services like that in-house, especially right now with a lot of stress happening?
Yeah, absolutely. We do have chaplains here on campus, and they're a great resource for the staff or for patients, and there's always someone on call. So don't hesitate to call them for yourself if needed, or for your patient, or maybe even a coworker that just experienced a stressful event. Mm-hmm. Reach out for that help. Also, this is interesting, impact of staff on patient satisfaction. And I think that points to if the nurse is exhausted, not eating well, you know, at their breaking point, they're probably not going to provide as high quality care to the patient because they're so depleted. And so if I'm feeling well and I'm healthy and I have energy, I'm going to provide higher quality care to my patients. And they pick up on that. The patients notice if I'm smiling, if I'm in a good mood, or if I come in and I'm not speaking to the patient's going to wonder, wow, is Sarah having a bad day? what's going on with her. So that's why it's really important to care for yourself. Okay, care of coworkers. This picture is of a previous RN residency group that has graduated, so that's a great photo of them. And as I'm sure you've experienced, as you work with a team, you often grow close to your coworkers because you bond with them. A lot of times you're at work more frequently than you're at your own home, right? And so you spend so much time with your coworkers. It's really great to have a good relationship with them and have a good team environment. Listen to each other. Be respectful. You may not always agree, but maybe have a mediation meeting with a manager, a supervisor, if you're not able to agree amongst yourself. I think a lot of times as nurses we're really passionate and we do have those strong opinions, and maybe our goal is the same, we want what's best for the patient, we just have different ways of achieving that goal. So treat each other with respect, and of course there's always nurses that you can learn from, that maybe your mentor, or maybe they helped precept you. You're all going to be getting some preceptorship when you start on your unit, and so you will probably develop a bond with that preceptor. So they're a great person to go to, even after you end your orientation period. If you have a question, if you have a concern, reach out to your preceptor. Okay, clinical practice. We're always wanting to improve our patient outcomes. I know Kelly discussed the different quality outcomes that we're trying to reach for our patients, and we always want to do better, right? We're always trying to have less falls, less infections, higher patient satisfaction, higher patient census. We're trying to do what's best for our patients. And so it's really important that bedside nurses are involved in decision making because they are there on the front lines and they know what they're experiencing with the care when decisions are made. So their input is really crucial. Patient incident reporting. So we do have IRIS, which is our incident reporting system. That system is not punitive. So if you complete a report, you're not going to be disciplined for filling out a report. We want to keep track of that information so that we can do a root cause analysis if needed and try to prevent it from occurring again. And safe patient handling program. One thing of nursing that I think has affected so many is hurting yourself when you're transporting a patient. Maybe you lift a patient and they weren't able to assist you as much as you anticipated, or maybe you turned the wrong way, but there's so many opportunities for harming yourself. So take precautions. We have equipment here. Grab a buddy. Do safe handling practices so that you do not become injured. What is your why? Why are you here? Why did you become a nurse? Maybe you've been a nurse for a long time and your why may have changed. Maybe it was originally for you and now it's more for others. But think back to why you're here. What's your goal? What's your intention? This is a picture of shared governance, and shared governance is the organization I was discussing earlier, which you are all able to be involved in if you wish to. And so we have multiple different councils that affect different decision-making areas. And so if you find an area that really interests you, maybe it's your passion, maybe you love research, that could be a way that you can get involved on the research council. And so this is a picture of all of shared governance meeting together. And I'll say this picture is nurses that are bedside nurses, nurses on the front line. This isn't all administration, this isn't all of the people at the top, this is people at the front lines, which is really great. Staff communication. So first and foremost, we communicate via email. So the expectation is to check your email at least once a week. I know that you're very busy. I know sometimes you forget, but if you can try once a week, that's great. Most of you are working 3 shifts a week, so just during one shift, check your email, spend 5 minutes. Sometimes the managers will send out updates via email, especially with this COVID-19 crisis that's going on. We're getting email updates with that, so that's a great way to be informed. But please check your email frequently. You'll also get reminders if your BLS or ACLS is expiring, so that's important to look forward to as well. Our website, the Insider and blog, is one of our main tools on our website, and I'm sure you'll receive instruction for how to navigate through our website step by step, but there's always good information on that website. Communication boards. I think every unit has their own way of communicating, and sometimes they're listing pertinent information or statistics, how many days has it been since the fall, or things like that. Those are great things to refer to. Down at the bottom, practice updates. Here we use Hub as one of our learning modules, and so you'll be assigned some modules as a new hire. So it's really important to complete those, and some of them have 30 days to be completed, some have 90 days. But you'll get updates, even as you are working, maybe you've been here 2 years, you'll get an update. And so complete those updates. We had one recently on COVID-19. But there's always something new. Nursing is always evolving. So here's a little breakdown of the different levels of the updates. So sometimes you have a longer period of time, like for level 1 you have 4 weeks to complete. But at level 4 you only have 1 week to complete, so they're time sensitive. So that's another reason it's important to check your email once a week. That way you will get a notification that you've been assigned this new update. Sometimes these are driven from an event that's happened. We realize that there is a need, there's a gap where the staff isn't educated, or it could be just a change in practice. Okay, recognition. So we love celebrating nurses that have certifications. So if you're interested in being certified, we support that, and we'll reimburse the testing cost if you go to get tested. Professional organizations, there are many national and even local organizations here in Little Rock that you can be involved with. Degree advancement. We have partners with a lot of different facilities. If you're interested in getting your associates, your bachelor's, your master's, your doctorate, whatever your aspiration may be. There are many programs online in here in Central Arkansas that you can participate in, and we do reimbursement for those programs. So I can give you more information if you're interested, but if you would like to be reimbursed, you need to complete the form online and get your manager to approve that class that you're taking. There are also some scholarships that you can apply for. I think the scholarship applications go out twice a year. So that's something you can check your email for in our website if you're interested in applying for one of the scholarships. Okay, clinical ladder. This is a great picture of some nurses celebrating clinical ladder. So maybe you don't want to advance your degree or you're already certified. This is still another way to promote and grow as a professional by being involved in the clinical ladder. And so this is also based on the American Nurses Association, and there are 4 levels of clinical ladder. So you have to meet the criteria to be eligible, and then promote, and you turn in a binder showing proof of meeting the requirements. So this is a great way to be involved, to grow as a professional. I will mention it also comes with a pay adjustment, which is something that people are interested in. But the sky is your limit, or whatever you want to think. There's always ways to grow. There's always ways to, grow as a professional, go back to school, or whatever your goal might be. St. Vincent is a magnet facility. Specifically, the infirmary is magnet recognized, and the Morrilton campus, which is a smaller campus, is on the pathway to excellence credentialing. So magnet recognition, there's some statistics. It's really difficult to become magnet certified, and it's something that we take a lot of pride in because it is a process, and it's based on nurses, nursing retention, nursing satisfaction, and also outcomes, patient outcomes. So this is only 8% of hospitals carry this designation, and only 2% receive the redesignation. And so we were first designated in 2013, and then we're just recently redesignated in 2018. And so currently there's only one other facility in Arkansas that's achieved magnet status. So that is something that we're proud of. There are many great facilities all throughout Arkansas, but we're really grateful to have achieved this recognition. And this is really great. It's about excellence. That's one of our core values. No one's perfect. We can't ever get perfect patient satisfaction or perfect outcomes, but always striving for excellence, which is why we've met that magnet criteria. These are some really nice pictures celebrating when we got our magnet designation and redesignation. And up at the top is a picture of someone receiving the DAISY Award, which is the national award given to nurses. So I mentioned there's multiple awards we have here. If you see a coworker, going out of the way, reaching for excellence, please nominate them. And the DAISY Award is a great award for a nurse to receive. Okay, professionalism. So professionalism is something that nurses take seriously because nursing is a really valued career. We're the most trusted profession in America. People turn to nurses more than they turn to doctors or teachers or any other profession. So we want to keep our professionalism high. One way that we do that here is through dress code. So always make sure that you're following your dress code. Whenever you show up for work, you want to always have your badge on for identification. And here, while we're having no visitors, you have to have your badge to enter the facility, so that's really important. And then whether your dress code is business attire or in scrubs, make sure that you're showing up to work in your dress code, and of course always on time. It's imperative to be on time. That affects your teamwork with your coworkers if you show up prepared and on time to your unit. So maybe leave a little bit early if you're worried about traffic or construction. I know there's a lot of construction projects going on, but do your best to show up early or on time for your assignment. What do you need to make a priority? I think, of course, attendance is a priority. If you sign up for a shift, you need to show up for that shift and show up in dress code and on time. What questions do you have?
Do you have a way for nurses to do any kind of research or access journals or anything like that if we wanted to, for example, participate in some kind of a project on our unit, or do I have to go buy those?
Yeah, we have some references that are free that you can access via our website, and one of those is Clinical Key, and so you can search articles, or I just recently learned you can search drugs if you have questions about medications. So that's a great reference if you're doing a project or wanting to do some research. Any other questions? Okay, thank you.
Thank you, Sarah.